Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
thermal complications of anesthetic agents. Malignant hyperthermia. Malignant hyperthermia is mainly mediated by chromosome 19. The major pathology of malignant hyperthermia. Rhinodine receptors. These rhinodine receptors causes here in malignant hyperthermia, there is a mutation in Dinodine receptors, and because of that, there is increased accumulation of calcium occurs in sarcoplasmic reticulum, thus results in sustained muscle relaxation leading to heat production,
Sustained muscle contraction leading to heat production.
which causes hyperthermia. Drugs implicated in malignant hyperthermia. The most common drugs implicated are suxamethonium. Inhalational agents or volatile agents seen in malignant hyperthermia. Maximum volatile agents seen are halothane. The risk factors of malignant hyperthermia. Positive family history or muscular dystrophies are the risk factors of malignant hyperthermia. Clinical features. A patient with malignant hyperthermia presents with hypercapnia. Hypercapnia is the earliest sign of malignant hyperthermia. Hyperthermia or increased temperature is the most specific sign of malignant hyperthermia. Hyperkalemia leading to ventricular fibrillations is the most common cause of death in malignant hyperthermia. Sympathetic symptoms may be present. There can be acidosis, renal failure, or myoglobinuria is seen along with the death of the patient. Thermal complications of specific treatment of malignant hyperthermia is dantrolene sodium. So general treatment includes we should stop the triggering agent. Hyperventilation can be given with 100% of oxygen. We have to treat the arrhythmias, treat hyperthermia, we should treat hyperkalemia and treat acidosis, maintain the urine output also. So when do you suspect malignant hyperthermia? And if you suspect malignant hyperthermia, then what do we do? When we suspect malignant hyperthermia, we should do screening test. That is, we monitor creatinine kinase levels. If creatinine kinase levels are high, then the patient is susceptible to malignant hyperthermia. If the creatinine levels are normal, then we should do muscle biopsy, especially from quadriceps. And in the quadriceps muscle biopsy shows caffeine halothane contraction test. Then if caffeine halothane contraction test is positive, then it is susceptible. If caffeine halothane contraction test is negative, then it is non-susceptible. Gold standard test to rule out malignant hyperthermia is caffeine halothane contraction test. Anesthesia, then once you know that the patient is susceptible, then the anesthesia which is suitable for susceptible patients are anesthesia of choice for a susceptible patient is we give regional anesthesia. General anesthesia can be given, but regional is the anesthesia of choice. Intravenous anesthetic agents like propofol is protective. For maintenance agents, intravenous opioids is given if general anesthesia is given. Then non-depolarizers are protective and mild hypothermia should be maintained in the patient. Complications.
So, summary. Thermal complication is malignant hyperthermia. Malignant hyperthermia is mediated by the chromosome 19. Then, in here, there is defect or mutation in Dinodine receptor which causes accumulation of calcium in the sarcoplasmic reticulum, which results in sustained muscle contraction leading to heat production, causing hyperthermia or increased temperature. Drugs implicated are it is mainly caused by suxamethonium, and maximum it is seen in inhalational agents like halothane, most common with suxamethonium. Then risk factors are positive family history and presence of muscular dystrophy is a risk factor. Clinical features of malignant hyperthermia: earliest sign is hypercapnia. Most specific symptom is hyperthermia or increased temperature. Most common cause of death in malignant hyperthermia is hyperkalemia leading to ventricular fibrillation. When sympathetic systems are present, sympathetic symptoms may be seen with acidosis. There can be renal failure and myoglobinuria is seen, and the patient can result in death also. Treatment is dantrolene sodium is the drug of choice. General treatments include stop the triggering agent. We can give hyperventilation with 100% of oxygen. You should treat the symptoms, like you should treat arrhythmias, treat hypertension, hyperkalemia, and acidosis should be treated, and maintain the urine output. Once you suspect malignant hyperthermia, then you should screen with creatinine kinase. If it is high, then the patient is susceptible. If creatinine kinase is normal, then we do muscle biopsy. If in the muscle biopsy you will do caffeine halogen contraction test. If caffeine halogen contraction test is positive, then the patient is susceptible. If it is negative, then the patient is not susceptible. Caffeine halogen contraction test is the gold standard test. Anesthesia for susceptible patients is regional anesthesia is the anesthesia of choice for susceptible patients, and general anesthesia we give IV propofol, which is protective. Maintenance anesthesia we can give IV opioids are given. Non-depolarizers are also protective. Mild hypothermia is also protective.
Thank you and thank you for watching.